a really frustrating group to deal with, but it just takes constant education and engagement in the medical system to keep them healthy. Okay, so if you look down on the bottom, the major risk factors, nocturnal awakening for dyspnea. Your lowest airflow is at night, that's why you're most at risk for symptoms. Pay attention to those, ask about them. How often? It's one of the things in that chart that we talked about in terms of classifying severity was based on how many nights a week are you having to wake up to use your beta-2 agonist. Increased use of beta agonists, you all got that. If you're using it more, you develop tachyphylaxis, you're not using it correctly, your airway is not well controlled, maybe you've dropped off your steroid. Increased variability in peak flows. The more they are all over the place, the more likely they are to have an exacerbation. Look at minor risk factors. So if allergy is a huge part of their asthma, they're at higher risk. So controlling that allergic component is important. Food allergies could fall under that. Also aspirin, about 10% of people with asthma also have an aspirin allergy or a non-steroidal allergy. Ask about those. They're probably the highest risk group for those types of allergies. Look under sports and exercise. Basketball and track, probably the ones that keep you moving the most and also really cool down that airway, are the highest risk for fatalities in young men. So paying attention to their airways, but also pre-treatment that we've talked about with exercise is important. Illicit drugs, cocaine, heroin, smoking, respiratory viruses. After people with asthma have a virus, their airways stay hypersensitive for about 2 to 8 weeks. Okay? So lots of variability, lots of problems that occur even once they go home. More during menstrual periods, so changes in hormone levels. Others would be the longer the duration of asthma, the more inflexible and rigid that airway becomes. Non-adherence, big problem. Elderly, again, probably from long-standing asthma. And then comorbid diseases or delay in getting care. That was the problem with the two women story I shared with you. Other measures, FEV1 less than 70%. It's a cautionary, but if they live there, they're more at risk. And then again, poor perception of dyspnea. Most patients with asthma underestimate the level of dyspnea they have. I feel like a preacher. Okay, let's take a break. We'll come back at about 15 after and we'll